This is your Houston chiropractor, Dr. Gregory Johnson. And today we're going to be going over examination and treatment of a patient who's been involved in a whiplash injury and is having neck pain and shoulder and arm pain as a result of that accident. So the first thing we're going to do is a few evaluations just to find out exactly what's going on. Now, first thing we'll have you do is bend your head forward all the way. Now that pulls right through here, doesn't it?
Yes.
Does this make that worse?
Yes.
Yes. Okay, now backwards all the way, please. Yep, that hurts right there too, doesn't it?
Yep.
Yep, now normal. Okay, good. Tilt your head this way. Ooh, that really hurts.
Yep.
Now, does this make that worse?
Yes.
This is a shoulder depressor test, and as you can see, she's got very limited range of motion. Okay, now let's go right. Ooh, even worse on that side, and I know this hurts even more.
Yep. Oh.
Yeah, this is a shoulder depressor test positive. Now, have you turn your head to the left, please? Now, see, she goes pretty good to the left. Now, to the right. Very restricted compared to the left range of motion. Now, back to center. Now, I'm going to push straight down. This is called a maximum foramina compression test. Is there any increased pain there?
Yes.
In the lower neck?
Yes.
Okay, now I'm going to go backwards and to the right.
Oh.
A lot worse?
Yep.
Okay, down here? And then here?
Yep.
Okay, does it shoot down into your shoulder when I do that?
Yep.
Okay, now, we're going to go over this way, and how about that one?
No.
Not as bad.
No.
So, see, she has a positive foramina compression test on the right with pain shooting out into her shoulder from her lower cervical spine. So we know now that she's got pinched nerves already. Now I'm going to do the muscle test. I'm going to push straight down. You hold it up. Hold real hard. Okay, now that was very mushy and weak. We're going to do the same thing with this one. Hold real hard. This one's even mushier. This is the problem arm, right? Did that feel weaker to you?
Yep.
Did that also hurt?
Yep.
Okay. Now, we're going to test her biceps muscle. I'm going to pull out. You resist. Okay. Again, mushy. Now I'm going to push in. Resist. Now I'm going to push in. Okay. Now that was pretty good. So far what we've seen is she has C5 and C6 weakness. So next thing I'm going to do is I am going to check your muscle strength here. I'm going to pull out. Good. Now I'm going to push in. Now that was a little weak on that side. Did you notice that? Weaker on this side than that side. So she's got a C7 weakness over here on the triceps. So next thing we're going to do is check her reflexes. Just relax it right in my hand. Good. Good reflex there on the right biceps. Good reflex on the brachioradialis. And good reflex on the triceps. Now this is the problem arm. So we'll see if this one's different. Much lower reflex. On that side, it's +2 equal and active. That was a good one, and that was a good one. So she does have a C6 nerve problem here. Okay, now, next thing we're going to do is we're going to evaluate her shoulders, and look straight ahead for me. Now that hurts right there already, doesn't it? Mm-hmm. And that's even worse. Yeah, see, we can't even move her arm really through a full range of motion without it really hurting, and there's a lot of popping and grinding going on in there. And then we go the other way. Yep. Now lift straight up. It kinks right there, doesn't it? Mm-hmm. Does this make it worse?
Yep.
Yep. Okay, now internally rotate like that. Does that hurt?
Not as bad.
Okay, how about when we go this way?
Yeah.
That does. Okay, how about when we come back?
Yep.
And how about when we go forward?
Yep.
Okay. Now let's do the same thing over here. Circumduction, forward. Not as bad on this side, but still a little bit kinked, but not near like the other side. Okay, now I'm going to rotate you out. Is there any pain there? In your shoulder?
Oh. No.
Not like the left one, right? And nothing there either.
Uh-oh.
Now, I'm going to have you pull it up. Nothing there. Now, there's a little bit of constriction right here. Does that hurt a little bit more?
Just a little
Going
bit.
Backwards, but not like the left one, right?
I like the left one.
Okay, good. Now, let's have you go over on your stomach here for me, please, Faye. Faye's a very cooperative patient sometimes.
Most of the time.
Yeah, most of the time. We like having fun in here, so. Now, what I'm going to be doing now is a palpatory examination of the patient's spine. And I'm going to let this headpiece down just a little bit right here. And we're going to palpate her cervical spine. And now she's got an atlas subluxation or misalignment of the vertebra right here. And that's where you get your headaches, right there, and neck pain. And right there. You feel that, Faye?
Yeah.
This is C5, C6 vertebra. Those are out of place. Now she also has T1, 2, and 3 all misaligned to the left. And you can see she's got an increased hump here in her upper mid-thoracics. And I can almost assure you those are very sore, aren't
Oh,
they?
yes.
Now, this is her teres major. See, that's very sore too. Same thing on the left. Teres major is very sore. So what we're going to do is we're going to do some very, very light adjustments / manipulations of her mid-thoracic spine. There we go. Good movement. And upper thoracic spine. Now, I'm going to do a cervical upper thoracic adjustment here. Perfect. Good job. Same thing here. So thumb move right on the spinous process. There we go. Okay, now, see, that's already brought her curve down a little bit. So let's turn you on your back now, Faye. Very good. And she knows how to turn over. We don't ever ask the patients to sit straight up. And we haven't lost a patient on the floor yet. We don't want to start with Faye. We never hear the end of it. All right, there we go. Perfect. Now, all I need you to do is relax, and we are going to get a straight... Now, see, we're checking her range of motion again, and as you can see, it's very locked up right here. So just breathe. There it is. I just adjusted her C1 and C2 vertebra, which is right next to her skull. Take a deep breath, curl your toes up. What I'm doing now is I am causing, now relax and breathe out. Deep breath in. This is causing the cerebral spinal fluid to pump up and down the spinal cord. Breath in, toes up. Excellent. Very good. Now, let's set you up and face towards Renee, sideways, like we showed you. Now, she knows how to get up, right? That's good. Now we're going to be adjusting this problem shoulder right here. And look, from just the cervical adjustment, though, it's already an increased range of motion. That didn't hurt as bad as the first time, did it?
No.
Now, just relax this for me. That's all. And we're actually going to open this joint up a little bit today. There, perfect. Good job. Now, let's have you move that around again. How does this feel compared to the first time?
Better.
Good. Now, let's do this one. Much better. This one's going to be a lot easier. Excellent. Now, here we're going to do a re-exam on this now. Let's check your muscle strength again. Look straight ahead. I'm going to push down. You hold it up. Now, is that stronger?
Mm-hmm.
Much stronger. Good. Let's do the same thing over here. Hold real hard. Much stronger on both sides. So we got great improvement in her strength there. The very last thing we're going to do is we're going to adjust her atlas on the x-axis with her body and her spine mirror imaged. So let's come over here in front of the mirror. Okay. No, come back this way, Faith. More. There, more. Okay, now, on this one, I'm going to have her close her eyes, flex your head forward all the way. Now see, that still pulls, but there's a much greater increased range of motion already. Now backwards all the way. So that's better too. Now neutral. Take a deep breath. And let it all out and relax, but keep your eyes closed. Now, she's got a much better alignment already. Now, you want to make sure the patient doesn't ever fall over, so you have your hands there available to make sure that doesn't happen. And so we've got a good alignment there, so we're going to have her open her eyes now. I want her to lift her shoulders up and hold them back. I'm going to bring her head straight back in the Z-axis. We're going to put a little extension in it, and we're going to adjust that atlas. Just relax. There you go. Right there on the X-axis. Keep that head straight, eyes open. Right there. I'm going to adjust your upper dorsals here and relax again. Now, flex your head forward again. Very good. Backward again. Excellent. Now, neutral. Take a deep breath and relax. Now, you can open your eyes. Now, how did that feel compared to when you did it the first time?
A lot better.
Good. Very good. This is a whiplash patient with neck pain and pinched nerves in her neck affecting her shoulder and all the way down into her arm and hand. This is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.